Hey guys, what's going on? It's Joe from Iron Health here at CrossFit Peekskill with our friend Maureen here. And we're just gonna go through a quick assessment of a squat, how and what we look at without a barbell, and then what we look at with the barbell, and then how to dive into it to see exactly what's restricted or where they should be squatting. Well, first thing when I look at someone is to look at a very restricted squat. So feet shoulder width apart, Maureen. You're gonna bring your arms up to the ceiling, as high as you can go. So right there, like that already could tell us things with their shoulder mobility, the thoracic spine, and I could see she's a little restricted. Like, does that feel awkward to be there?
A little bit.
All right, and then from there, we're just gonna say squat as low as you can go. All right, come back up. So let's try it again. Try to keep your toes straight.
Okay.
And at the bottom, I want you to hang out for an overhead squat. Good, and she's actually a good example. You could see her feet do not like to stay straight. So all we're doing with a squat like that is saying like, what's restricted, where are we gonna dive into for a further assessment? So let's try one more, but face this way, please. Good, and from the side, you'll actually see the thoracic spine, you'll see the hips, seeing where that's aligned. So it's always good to assess from the front and then from the side. You always have to look at both angles. This is also gonna show you the knee, it's gonna show you the ankle, it's gonna show you the shoulders. And just in that position, I could tell she probably doesn't like that, right? Come on up. So that's the way you would assess it without any work, any barbell work and stuff like that. It's an assessment. This is not how she's going to squat in the gym, right? Because it's just two different assessments, two different techniques. So let's grab a barbell. Behind the back. And now I'll say like, let's see what you squat like comfortably when you're here in the gym. Good. Come up. Let's do like 5 of those. Good. Okay, 5 like that, keep going. So we're looking at knee angle, we're looking at ankles, we're looking at their chest, where they're positioned, we're looking at their pelvis and everything like that. And she's actually a good example because what I'm noticing already is something's going on with her right leg. It's showing up with a strict squat, showing up with a barbell squat. Can you turn and face that way? Which leg do you have surgery on?
Left.
Let's see 5 that way. Good, same thing. Where's her spine? Where's her chest? And she actually looks a lot better with a barbell than she does without it, which is common, right? It's common, but it's not good. Okay. So, you mind if I talk about your history? Or do you want to talk about?
So I had hip surgery, labrum repair in October of 2017. And since I've had that surgery, I've had ongoing hip issues. I've still had pain in my left hip. It's all on my left hip. And so I had an MRI with contrast this past week. So hopefully nothing else is still going on with it.
Nice,
But,
thanks. So from there, like she has a history of the left, but we see something going on with her right leg, right? So I'm like, what's happening? We have to break that down further. Another little assessment I use for the squat is you're gonna come into like your hands and knees here on the ground. And then get your feet wider. So go like, you would bring your feet as wide as you are in the squat. So your knees as wide as you go on the squat. Okay, and from here, what I'm just gonna tell you to do is rock back as far as you can go. Good. And what you're looking at here is, what is their angle of their spine? Do they have kind of a lumbar flexion? Does it bend in? How do their hips move? Do you have any pain there on the left? You do, where? Okay, so she has pain too, so we would have to dive more into that. Rock back forward again. Go a little wider with your legs. And try that. Sit back, sit back. How's that feel? Not good. More pain in the front and the groin of the left. Okay, come back forward. Good. Okay, let me see one more here. Okay, good. Come back. So on surface level, she actually looks pretty good. A lot of times people's like pelvis will tuck under, but the fact that she has pain, you would actually dive into that and say like, why is that happening? Why does that consistently keep happening? So she's a good example to say we have to go from the top down, right? We look at her functional squat, then we come here, and then we're gonna look and see the hips itself. You like pop on your back? Mind if I move your hip?
That's fine.
Straighten that one. So after that situation, right, we broke down the squat. Now we're bringing it down to the isolated joint. I'm seeing flexion first. What I look for is where does the knee move? Does it sway? And she actually has good motion. It's smooth, it's controlled. From here, I'll look at internal rotation and then external rotation. So overall, this hip actually moves really, really well. And then we just want to compare. Tell me if you have any pain. It's tight, yeah. So right away, like, there's a restriction here. We're hitting a barrier. So to me, that can mean that the joint itself can be stiff, so we would have to dive more into that, right? If the joint is stiff, when she goes to squat, she's gonna be shifting to the right. That right joint's gonna have to be more mobile. So from here too, we'll look at rotation, pain. It's pretty good, right there. End range pain, and nothing here. And I could see too, she's still stiff here. Like if you look at her right leg, when I go into external rotation, you see how it moves? So that means that this hip is still stiff. So something's going on either in the joint or tissues that we really have to work on to address that. So from there, you can see, like, from breaking down the squat into isolation, you can see how someone's squat is affected, what's restricted, what's moving well, and what's not.